Good afternoon, distinguished ladies and gentlemen. I am Dr. Udoh Ekaette on the Department of Pharmacology. I'm here to present on the paper Restoring Metabolic and Mental Health, Therapeutic Potentials of Corchorus olitorius in a Polycystic Ovarian Syndrome. These are my contents and a brief background on the introduction. So Polycystic Ovarian Syndrome, known as PCOS, is a metabolic endocrine disorder that arises due to hyperinsulinemia and leads to hyperandrogenism that worsens the follicular development. And this is common with women of reproductive ages and has been linked to a depressive state. Because of that, decline in productivity. Of late, we've been having a higher incidence of polycystic ovarian syndrome. The picture is depicting a normal ovary against a polycystic ovary. For the statement of the problem, we hope to address three major gaps. One, the scientific gap of oxidative stress pathology in polycystic ovarian syndrome, the need for alternatives, and also the use of computational model to postulate molecular mechanisms of these alternatives on PCOS pathology. For the aim and objectives, we hope we investigated the ameliorative effect of Corchorus olitorius and try to explore on the metabolic potential. For the materials and method, the study was in two phases. We had an in vivo and an in silico. For the in vivo, the condition was simulated in animal studies for 14 days using letrozole and treated for 21 days. And we had 6 groups. For the in vivo, the parameters assessed were hormonal assays, lipid profile, blood glucose, and ovarian histology. For the in silico, we characterized the phytoconstituents in 4 extractive medium using GCMS. Above are the settings of the GCMS. Then for the in silico docking, we made use of advanced molecular docking tools, Pyrex, Pymo, and the rest of them. And we conducted the post hoc in silico study validation using Schrodinger Maestro. And then we did molecular dynamics on a key lead compound. And the parameters of interest were anti-androgenic, anti-inflammatory, and antioxidative properties of C. olitorius. These are some of the results I have for the hormonal profile in overview. For the lipid profile, we will notice that in PCOS state, we have dyslipidemia, whereby LDL, VLDL were elevated. And for the treatments, there were significant declines in them over time in about 5 weeks. For the blood glucose level, and for the treatment, after 5 weeks of treatment, there were declines in them. For the histology finding, for the histomorphometry, we noticed that in the PCOS subsection B, we had cystic follicles, that's follicles without viable ova. Then for the treatment, we noticed decreases in these cystic follicles and emergencies of mature Graafian follicle and secondary Graafian follicles in them. As a result of that, in the in silico study, we characterized the phytoconstituents. Then we had 22 phytoconstituents, in which 15 passed the sweet asthma and protox testing. That's the pharmacokinetics needed to make a compound a druggable candidate. And then we did analysis of our bioactives of C. olitorius against standard drugs. We did a comparative analysis in which camphorous, stigmasterol, even better than the standard drugs in the market. As a result, polycystic ovarian syndrome, and this will lead to better metabolic recovery and improved mental health state of mind for such females. As a result of this, their economic productivity will definitely be better. And in a low-income economy like Nigeria, this will be very, very obtainable. Okay, in conclusion, olitorius shows promise as a druggable compound, and these are my references. Thank you.